Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Now let's talk about preoperative chemoradiotherapy for resectable esophageal carcinoma. So adding radiation therapy in the preoperative treatment of gastroesophageal adenocarcinoma resulted in no survival benefit over chemotherapy alone. Why is this important? Well, just think about it if you're a patient. First of all, the side effects of getting radiation. But also, is your life going well when you have esophageal carcinoma? You're probably not going to be eating well. You're probably not getting great nutrition. And just think, you have to get somebody to drive you to get this radiation therapy. You have to be able to get the radiation therapy. You've seen patients with who've undergone radiation therapy. Is their life great at that moment? No, it sucks. So this is an opportunity to reduce pain and suffering for patients. So this is inpatient, the EPOC Trial, we'll call it that. Patients with esophageal or gastroesophageal junction adenocarcinoma. So they had two arms, one where they received FLOT chemotherapy, which is fluorouracil, leucovorin, oxaliplatin, or docetaxel, part of the FLOT chemotherapy, or perioperative chemoradiotherapy with carboplatin, paclitaxel, and radiotherapy. Now, what they measured is a progression-free survival of 3 years with FLOT was superior to chemoradiotherapy with no new safety signals. And the progression-free survival was pretty significant. The FLOT compared to the chemoradiotherapy was 51.6 to 35% progression-free survival of 3 years. And the tissue response was 12.7% versus 10.1%. So big breakthrough for resectable esophageal carcinoma in the perioperative and preoperative treatment levels.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.